Thank you so much for joining us today for session 1 of our 3-part series. My name is Ellen Albright. I am the Director of Workforce and Talent Development with GRCA. We are thrilled, absolutely thrilled to be partnering with BCIU and our local school districts to provide this forum and educational series for our community to help us all navigate what we are looking forward to as far as reentry, both for our schools, but also in pairing that conversation with how our businesses are handling reentry and back to work for their employees, especially those with school-aged children. So we felt this was a really timely, important conversation for our community. And so we're really thrilled and happy to be providing this in 3 different parts so that we don't rush the conversation and we're able to provide a ton of really timely, informative information for everybody who decides to join. So a quick plug there, if you haven't already, there are 2 more sessions. We will go over those later in the call, but that will certainly encourage you to comprehensively be a part of the conversation and join each of the 3 parts of the series. At this time, I would also like to introduce Katie Hetherington-Comfer. She is also with GRCA and she is our Director of Government and Community Relations. She is brave and is using a virtual background and makes it look good. So you should see her on your screen, and she will be co-presenting some of the questions today and helping me facilitate as we navigate the conversation. Couple of just ground rules and things to think about throughout the call today. We understand that many of you have questions. I think we all still have questions. And so to be mindful of that and to be mindful of time and to make sure that we're getting you the best information that we possibly can. If you have a question, a comment, anything that you would like to bring to the table today, please throw it in the chat. We may not have time for Q&A or a lengthy discussion at the end of today's presentation, but we certainly do want to hear your feedback, your questions. So if as things come up, please just throw them in the chat. We will save the chat and work through that. Both GRCA and BCIU will be happy to work through those questions and possibly get some answers out to each of you as a kind of a post session from today. So we will work through that. And again, please just throw your questions and comments in the chat. We ask that you try to not unmute throughout the session just so that we don't have background noise. Again, there's a lot to get through today, so we want to be really mindful of time and of our presenters in being able to get through their information. So at this time, I would really like to introduce Dr. Hackman with the BCIU. I have a wonderful bio here, so I am going to cheat and read it to perfection because I want to really help you to understand the background she brings to the table and the experience and knowledge that she can bring to our conversation today. So, Dr. Hackman joins us today as the Executive Director of the Berks County Intermediate Unit. Prior to her appointment as Executive Director, she served as the Director of Early Childhood and Student Services, BCIU's largest office that provides programs and services to more than 5,000 children. She is a member of the University of Pennsylvania School Study Council, serves as a board member on the Berks County Council on Chemical Abuse, United Way of Berks County, and the Greater Reading Chamber Alliance. In addition, she is on the advisory board of Penn State Berks, is vice chairman of the Berks Business Education Coalition, president of the Pennsylvania Association of Intermediate Units, and superintendent of record of the Berks Career and Technology Center. I think she needs a nap. In September 2019, Dr. Hackman was also selected by Secretary of Education Pedro Rivera to serve with him on the Coherence Lab Fellowship, a research initiative which brings together state, district, and school leaders for an 18-month fellowship focusing on policy and best education practices. Dr. Hackman is committed to ensuring that BCIU provides high-quality and cost-effective programs and services for Berks County school districts, charter schools, private schools, and other organizations and agencies that serve children. At this time, I'd like to allow Dr. Hackman to say a few words, say hello, and also introduce our guest superintendents present for the discussion today. Dr. Hackman?
Great. Well, good afternoon, everyone, and thank you, Ellen, for that kind introduction. I'm humbled by your words, and it's great to see many familiar faces here connected with us today, and having this opportunity to have this conversation as a 3-part series. On behalf of BCIU and our 18 superintendents, we do want to say a special thanks to the Greater Reading Chamber of Alliance for providing this opportunity for us to collaborate on a 3-part series. And kicking it off today is to talk about our roadmap for reentry and where we're at as of July 15th. And you'll hear more about what that means because July 16th could look different. Every day it seems that we continue to have new information, but that's part of our leadership and how we're collaborating across the county is as new information is learned, we will continue to pivot. We're flexible, but most importantly, focus in on being supportive of our staff members, our students, and our parents across Berks County as we plan for the reentry of the 2020-21 school year. I also want to say, before I do an introduction of my two amazing colleagues, a special thanks to Ellen for organizing this. It was her vision, it was her thought to say, let's give an update to the entire Berks County. And again, thank you, Ellen, so much for putting together this education series. We are so grateful for your leadership and your continued partnership. So before we get started, I do want to do an introduction. We have Dr. Gerhard, who is the superintendent at Governor Mifflin, and we have Dr. Grove, who's the superintendent at Conrad Weiser Area School District, who I'd like to introduce to you today. Dr. Gerhard is the superintendent at Governor Mifflin School District, serving approximately 4,400 students. His experience in public education spans nearly 30 years and includes time in the classroom and in leadership roles in the region. In 2015, Dr. Gerhard returned to his alma mater, Governor Mifflin, with a passion for uniting the community and the district in the important work of education. Governor Mifflin has 6 buildings plus a virtual learning academy, about 350 staff members, professional staff members, and an annual budget of $72 million. So Dr. Gerhard, thank you and welcome. And Dr. Grove, who is the superintendent at Conrad Weiser Area School District, serving approximately 2,500 students. He's held school leadership roles since 1999, joining Conrad Weiser Area School District in 2011. Dr. Grove's goals for his district include a strengthening of the academic programs of the district to include tighter alignments to standards and an increase in student-centered learning activities focused on higher order thinking skills. Conrad Weiser Area School District has 4 buildings plus a virtual learning academy, 240 professional staff, and an annual budget of $50 million. So again, I want to say welcome and thank you to Dr. Gerhard and Dr. Grove for willing to participate in today's first part of a 3-part series regarding the state of education. So with that, I'll turn it back over to you, Ellen.
Thank you so much. And again, thank you to our superintendents also participating today. We're going to kick off right away with a question from myself. Katie and I, like I said, are going to go back and forth, but we're going to kick off here by, again, we have about 7 questions prepared. We're hoping we have time for all of those. But before we do that, what we want to do before we dig into the Q&A is really give a comprehensive overview of the reentry plan. And so our best possible way to do that is through a very beautifully prepared PowerPoint that BCIU has come forward with. And so at this time, I'm going to allow Dr. Hackman to share her screen. And while she does, I'll pose the question. Can you provide us with an overview of how our Berks school districts, BCIU, and education leaders across the county are working together to create meaningful, aligned plans for safe reentry to education? And so through that question, I believe we're going to work through this PowerPoint to give a really comprehensive look at the work that's been done so far.
Great. So I will kick us off and all 3 of us will be presenting. And again, Dr. Gerhard, Dr. Grove, and I have put together just a framework through a PowerPoint to guide our conversation for that opening question. But before we get started, we do also want to thank everyone who has been truly supportive over the past 4 months during these unprecedented times. We've had community partners, elected officials, business leaders, parents, students, emergency services, everyone supporting us as we've been navigating through this unprecedented time. So it wouldn't have been possible for us to achieve everything that we have achieved, but now we are very laser focused in on what is to come for the upcoming school year and reentry plans. And so today we'd like just to give you an overview. And as you can see, we're going to talk about the collaboration that's been occurring, our guiding principles, the workplace Safe 6. We'll give you an overview of our actual roadmap for reentry and our decision points. We'll talk about the health and safety plan and our pandemic teams that are required. And then we'll have questions for consideration and then some closing comments. So that gives you the framework for this opening to give you an overview of where we're at. But I will share with you, all of this. And when we say we, it's been our 18 superintendents and our 2 career and technology centers who have been collaborating together with the BCIU to talk about what does that reentry process look like. And school leaders have been working together since March 16th when we had the mandated closure. But I think it's important to note that while school buildings have been closed, programs and services have continued. And we've been focused on the continuity of education for the more than 70,000 students in Berks County as the last 3 months of the school year and as we prepare now for the upcoming year. But this has all been a collaborative effort, and you'll hear more about that, those decisions that we've made as a team. It's important to start off with our guiding principles and priorities, and this is something that all of our schools across Berks County, this is what's guiding our work and our decision making. And the number 1 item would be the health and safety and wellness of students, staff, and community members. Number 2 is about delivering high quality instruction regardless of the delivery model. And then equity, providing access to resources and opportunity for all students that are involved. And then community and stakeholder engagement in the reentry and health and safety plan development. And this is something you'll hear more about, the plan development and how our local school boards are reviewing and approving those plans as we move forward for reentry into the new school year. And then item number 5 is on our list as well as a priority is how do we revitalize our economy post-COVID-19? So the whole economic development piece and how we work together in revitalizing our economy, the educational system plays a key role in that as well. To start our work, we really focused in on in regards to 2 months ago, the superintendents with the IU, we came up what we call our Safe 6. And the Safe 6 was how are we going to re-enter the workplace and make sure that people felt confident and comfortable to return, not only for essential functions such as business operations, human resources, but as we started up with instructional services as well. And those Safe 6 areas are around facilities and vehicles, staff, access and security, social distancing, cleaning and reduced touch points, and communication. So our work was centered on those 6 areas that we put into what we call the red, yellow, green model, that when we were in our phases, what would we be doing to prepare facilities and vehicles if we were in the red and if we're in the yellow and as we moved into the green. So this was a progression of our work and our efforts across Berks County schools about how we were going to move through the phases between red, yellow, and green to ensure, again, that people felt comfortable and confident to return to the workplace. Now, as you can see, it's small print on there, but as working through this, as you can see that the red phase was the initial phase that we started in, and we moved through the yellow, and now we're in the green phase. But all of those areas are important for us as we continue to plan for the upcoming school year. So the Safe 6 document will continue to guide our conversations and our work. But the second tool that we've spent a lot of time focused in on is the roadmap for reentry. So you're going to be hearing more about that from Dr. Gerhardt, and I'm going to turn it over to him to talk about the roadmap for reentry and collaboration and decision points. So Dr. Gerhardt.
Thank you, Dr. Hackman. As Dr. Hackman had shared, since March, as superintendents, if we're not meeting weekly, we're sometimes meeting twice a week in collaborating and trying our best to navigate this ever-changing and rapidly changing and evolving situation since then. So I'm just share a couple key points from the roadmap that we've been using in addition to Pennsylvania Department of Education's Health and Safety Plan that Dr. Grove will speak to a little bit later. But to introduce going forward, I think the key word, and I believe I heard Ellen say this as well, is navigate. I don't think there's a better word here as we navigate. The challenge, though, is we don't necessarily have a established map. So we've certainly have had to work to create what that map is. In a sense, that is what contributes to the framework that we've developed here with this roadmap. I think another key word, and it's one that I know I've used with my leadership team in the last few weeks, and Dr. Hackman and I have talked about quite a bit. It's not really the word change, it's more the word pivot. And I've told my team and my staff and parents, yes, I understand that yesterday I may have said this, and today I'm saying this. And that is because of the new guidance and information that we continue to get each and every day, and how we interpret that guidance and apply it to our school district context and our school district organization. We also receive that guidance from federal, state, and local authorities. And in essence, what is occurring right now, really across the state of Pennsylvania, is each local school district has been given the charge to reopen schools in the fall and create a health and safety plan in order to do that. Thinking about your local community context. Well, certainly I can do that planning and just think about the Governor Mifflin School District, but I also have to think about we're not that unique in regards to thinking about what the other county districts may look like. So that's why we're collaborating as much as possible. But in the end, while you'll see a lot of commonalities across our plans, there will be some unique contextual differences that exist based on the local decisions that were made. In addition, governance guidance, and Dr. Hackman back, governance guidance comes from the list that you see there on the right, but I'll also share research reports and the guidance documents, the American Academy of Pediatrics, early in the summer, what we call the P groups, the Pennsylvania Association of School Administrators, the Pennsylvania School Board Association, Pennsylvania PSCA, the Educators Association. These groups collaborated to create a very comprehensive report that we've also been using to guide our work, as well as the research report by Mathematica that was sponsored by the Pennsylvania Department of Education. So as we are making our decisions moving forward, we're really trying to stay grounded. That data is what needs to drive our decision making, and really taking a look at the local context, the county context in regards to increases or decreases in our COVID-19 cases. As Dr. Hackman had alluded to, we are creating our plans and operating off of the red, yellow, and green phases that have been laid out from our state government authorities, and creating plans around that. But the ultimate goal, as mentioned earlier, is to get our schools ready to reopen to serve the 70,000 plus students. What's important to note here, though, that in our plans and what we're looking at in each one of our districts is a variety of options. Everything from what might be modified schedules in the elementary day has different schedule approaches than the secondary day. We're also recognizing that we need to create a more rigorous and more robust online learning program, not only for families that want that option in the fall when we reopen, but also should we need to intermittently close. And that's been guidance that also has been given to us, that at a local level, we will need to be making those decisions on opening or closing intermittently through the year. Thus, we've been working to create, as mentioned a couple times earlier, this roadmap for how to guide our planning, how to guide our thinking, and also how to guide our communication come end of July, August, as we start approving our plans and releasing them to the community. In this roadmap, the larger categorical areas is what you see on this list. To appeal to the business community that is represented on this call, the first four are probably what we can all agree that we've had to deal with. If you think about organization-wide considerations, just to give you a specific context to Governor Mifflin, my organization, I have 4,400 students, and between professional staff and support staff, 600. So my organization, when I think about people on my campus, I have 5,000 lives that are on my campus that I need to consider, and the dynamic that goes with an organization at large. So I know when you think of employers and how many employees they have, my human capital is 5,000, and that's just when they're here on campus, in addition to all the families we serve. Then from transportation below are all the categorical items that are specific to our educational context. Within those categories, and again, it might be hard to see here, but we have itemized within each of those categories, what are the specific things that we need to consider and plan for. So for example, you see under organization-wide considerations, talks about employee surveys, employee engagement. I also add to that family, student engagement. So just last week as a district, and I know other districts have done this as well, we reached out to our staff, we reached out to our families, and we reached out to our students to get their feedback on where they are. Up to now, we're at about 3,000 responses, and that information and that feedback has been very helpful to continue our guiding to make sure that we are hearing their feedback and their input. When you think about human resources and all the different things to consider and plan for, one of the items, we all may work in different areas with our staff. We have collective bargaining agreements that have contractual language that speak to working conditions under normal times, and these are certainly not normal times. So we have enjoyed a good relationship with our labor groups, but have had to navigate and plan for adjustments to that language. Certainly under operations, I think we all deal with how do we best prepare our buildings, maintain our facilities, especially in planning for having 5,000 students every day. But also we're competing in the same supply chain that you are for protective equipment. And so we have to plan for how do we be responsive and having enough equipment here. And then lastly, one of the things that we pride ourselves on is we want to be open and welcoming our community, our volunteers, our parents. And with the unique nature of this pandemic, we've had to do some planning and some thinking around what that may look like. And then on the other side, thinking about our students' social and emotional well-being, how do we welcome them back? How do we make sure that their not only academic needs, but those social and emotional needs are met. And also as a school, we're not here just to educate students. We're also here to make sure that our families are well resourced. So how do we in this unique time, not only with the pandemic, but economically, make sure our families are well resourced? And certainly a huge challenge for us is not only educating all of our students, but also thinking about our students where it's already a struggle to learn. And those are our students that are identified with special needs. And recognizing that their very unique needs make it certainly challenging to meet during this time. So in those categories and those items, that is what's driven a lot of our planning and a lot of our specific contextual, here's what we're doing as an individual district in consulting the guidance and consulting the governance that we are under. And to reiterate Dr. Hackman's point at the very beginning, we recognize that there's strength in the collaboration, and we've been working as superintendents, recognizing that health and safety of our students and staff is the #1 priority. We each have unique community contexts, and we're working to develop that plan, but also doing our best and earning lots of character, but asking for patience from our community, because what was said yesterday will change tomorrow. But how do we best plan to be agile and flexible, knowing that this guidance continues to evolve each and every day? And to talk a little bit more specifically about the planning process itself, I'd like to turn this over to Dr. Grove from Conrad-Weiser School District.
Thanks, Dr. Gerhardt. And thank you to the Greater Reading Chamber Alliance, Ellen, for putting this together. I appreciate that, and Dr. Hackman for your leadership as well. If you can go to the first slide. So as Dr. Gerhardt alluded to, this health and safety plan is actually something that was required by the PDE, Pennsylvania Department of Education. And it does serve as a local guideline. And as Dr. Gerhardt said, many of us have collaborated, not just as superintendents, but many of the other job alikes in the county are talking about these plans at their meetings, at their Zoom meetings, as we've traveled through this path. And the guidelines, as you saw, involve things with instructional items and also non-instructional things that happen in our school districts. Each of these will be unique to the school district. You'll see a lot of commonality, but you're going to see some unique things based on feedback that we are all getting from our constituents. And I think, again, the name of the game here is flexibility, being ready to able to pivot when you need to. And you'll see in most of the plans, here's what's going to happen when we're in green. Here's what happens when we're in yellow. Here's what it looks like in red. And even within those categories, you're going to see some changes as we kind of travel through the next couple of days and weeks and months. In the end, a school district's board must approve the plan. It has to be submitted to PDE, and then we must post that publicly on our websites before school reopens. I know a couple of districts have already approved theirs, and a few districts, we're one of them, we're going to try to wait a little bit later and try to get as much information as we can before we finalize that plan. So the considerations that you'll see within the plan are the different types of reopenings. Dr. Gerhardt kind of alluded to all of those different options and opportunities. And you'll see in some of the plans, you know, school will look like this during green and maybe like this during yellow in a different way if we have to go back to red. PDE has tasked each of the districts to have either a pandemic coordinator or a pandemic team. Most of the school districts I have talked to and that I've interacted with have chosen to go with a team, and that's what we did as well. It seems to work well. We have a lot of expertise in our districts, and pulling in folks from the different divisions and the different portions of our district and bring their expertise.
That's okay. Did you have a good lunch?
So some of the key strategies or things that you will see in the plans kind of revolve around some of those facilities kinds of things, cleaning, sanitizing, disinfecting, some of those social distancing, other kinds of safety protocols. How are we going to monitor the health of our staff and our students, and then other considerations. Also, within those plans, we have to have professional development around some of those procedures and policies, as well as a communication plan. What are we going to be communicating out? How are we going to do that? What do the timeframes look like? Like I said, most school districts are doing pandemic teams, and their responsibility is really to develop the plan for this phased reopening, but then also to monitor the implementation and then continue to inform if we need to make changes. PDE has given all of us the kind of flexibility. If we approve a plan, let's say the first week of August, and school starts, and maybe 2 or 3 weeks later, we need to change that plan. We don't have to wait for another board meeting to make a change and implement. We can implement that change with the blessings from our board. They can approve that at a later date, but they've given us a lot of flexibility to be able to move, morph, and pivot. And I think that's a good word that Dr. Gerhardt used as things change on the ground. PDE has allowed us to have stakeholders from across the spectrum of a community, and you can see all the different folks that can be included. I think and I can say this from our team, one of the most important members of our pandemic team has been our school nurses. If you think about health and safety, even when we're in good times, our nurses are really kind of our point people that help us with our students. They often help our staff. But our administrators, we have teachers, support staff. We're bringing in information from our students, our families, and community members through our surveys. But they're really helping us kind of guide and inform that plan. And I'll say it again, our school nurses have been very invaluable in kind of making those linkages between, that health and safety, and then looking at our reentry plans. We're hoping with such a diverse group that this plan will be very successful and we can implement it. I will also say this, many of the pandemic teams across the county and probably across the state are building their community surveys from input with these teams. And that has really served us well. We had our survey went out, Dr. Gerhardt talked about theirs. We've got about 2,000 responses, and it really has informed and helped us with the direction of our plan, but also help us kind of tweak that and make sure that our community is supportive and understanding of what we're doing. So I really appreciate the work that our team is doing, and I know there are teams across the county and the state doing the same thing. So with all of that, I'm going to turn it back over to Ellen to continue with the presentation.
Jokes. Back to seeing all of your faces. Thank you so much for that really comprehensive overview. I believe it is extremely helpful for all of us to see how the districts are coming together, communicating with one another, especially with having so many business folks on this call. You know, we really want to be mindful in addressing their needs and their concerns about, if there were 18 different plans in Berks County, there would be 18 very different circumstances for employees of our employers with needs in working from home, continuing to seek out childcare. And so we're really thrilled to see that there is such a comprehensive approach to this so that we can also get our employees back to work. And so with that, we're going to dig into some questions here. First question, and I will defer to all of our presenters, and whoever wants to tackle each question is more than welcome. Put you in the hot seat. So, do schools face greater implications from failing to provide adequate educational experiences for students, or from failing to provide safety to students from getting sick? Anybody want to tackle that first one?
So I believe I was designated for that one.
Ah.
So I think well, that question, I think we need to first establish that there's nothing that comes before the safety of students. And I would add staff to that. As I mentioned earlier, students and staff combined in our organization is almost 5,000 people. But I think we also need to recognize that providing, and I'm not going to use the word adequate, I need to use the word excellent educational experiences for our students, that the two should not, the expectations that we're charged with is that they're not mutually exclusive. I mean, it's that while we understand the priority is the health and safety of our students, part of that health and safety comes from having excellent educational experiences. So I don't know that they're, if I said that because the safety of our students was number one priority, therefore don't expect us to provide a good educational experience, I don't believe our community would accept that. So I don't see the two as, mutually exclusive. But however, with that said, we know that that there certainly are some concerns that we are working to respond to make sure that we are putting in the best protocols that we can for our students and staff safety to give them the best, highest quality educational experience.
All right, Katie, you're up with the next question.
Yeah, Ellen. So we touched on this a little bit in your presentation, but kind of go further under the rabbit hole. Do school districts have the flexibility in their implementation of CDC and/or state guidelines when reopening? Can some practices be adjusted if it's found that they're too onerous to implement?
Great. Well, thank you. I'll take that question and start us off with a response. And it's a great question. When we think about the guidance coming out at the federal, state, and local levels, we take all that information and review it and figure out how does that work within the local context. I think it's important, though, that one thing that we've been sorting through a lot is in regards to mandates, orders, recommendations, and guidelines. So you hear all of these words about guidelines, recommendations, mandates, and orders. So that's been something that, whether it's the CDC, whether it's the Pennsylvania Department of Health, or whether it's the governor's office, or the Department of Education, we've really been working through as a county educational community, what does that mean from a local context? So the flexibility we have is really when it's a recommendation or a guideline, but when there's a mandate or an order that is signed either by the Secretary of Health or Governor Wolf, then there is no flexibility at that point in time. Now, interestingly, I'll share with you that the whole idea of flexibility, even when there is an order, then there will be exceptions listed within the order. So the recent issuance of the face mask order and face coverings order, that was one area that we recognized there were exceptions listed within that order. So how do you navigate that? How do you work through that as a school system or an education system when faced with those exceptions? So for us, our conversations have been collectively around recommendations and guidelines and how we want to implement those, And then how do we implement the idea of mandates and orders that are signed at the state and federal level? So that's an important piece for us as we, flexibility, and I don't even want to use the word that it's not possible. For us, we're very strategic and methodical about every decision that we're putting into any reentry planning or health and safety planning. And the flexibility would only come when it's not a mandate or an order.
Thank you. How will socioeconomic factors, food insecurity, for example, abuse, trauma, how will they be met with appropriate services moving forward?
I'll field that one. So let me talk a little bit about things that we've done, things that have happened, and then what we're looking at into the future. And I'll take each of those three buckets, I guess. So for food insecurity, I think every one of us, all of our districts, very shortly after the shutdown, continued to provide food for families in our districts through our food service, through our federal dollars. And that, for some districts, that happened at maybe in 1 or 2 locations. Several districts in the past have also done summer food or summer feedings, and they just continued on in that. Some districts were not, like my district, we normally did not do that. So we had a lot of local partners that stepped up. They have an Olivet Boys and Girls Club. We have a local food bank. But I think almost in every district there was continuous food provided, and that food security was provided to our families. And that will continue. If we get back to school and we have to go back and we have to go back to red and the kids cannot come to school, we have a plan to continue that process, and I'm sure that's happening in all school districts. In terms of abuse, I read a statistic, and Dr. Gerhardt shared this with me as well. When we were shut down, the reports of child abuse dropped about 50%. And that's really indicative of what happens with schools. We are often that front line, that first line as a reporter. We hear those things. We have school counselors. Our teachers are very sensitive to hearing their students talk about those things, seeing our kids as they come in and out of school. So we are mandatory reporters. That never stopped during the shutdown, but that will certainly continue as students come back to us. So we are very well versed in that. Our teachers are trained in that. There's mandatory trainings that we have to do every couple of years so that all of our staff understands their role as a mandatory reporter. It is more challenging to do when you're in a fully online environment, but we will continue to support our students and our families through the mandatory reporting. In terms of trauma, and this is something that all districts, I think, are starting to grapple with more and more as we understand the science behind it, as we understand the social and educational implications behind it. Many of us are ramping up our ability to teach, train, and professionally develop our staff. We're really appreciative of MHDD here in Reading, Dr. Mahalik, and the partnership we have with our local agencies. I know a number of school districts are also starting to do trauma-informed training for their teachers. In the Conrad Weiser district, about a year and a half ago, we partnered with the Penn Literacy Network out of Penn University, and we actually have a cohort of teachers. They're actually taking the Penn courses in person in our district, and they're getting their certification in trauma-informed teaching and learning. And it's been very valuable. But I see that continuing on as local partners and even college and university programs come and support our folks in learning and understanding how to deal with students in trauma.
Thank you so much. And I just thought of a follow-up question to that, but in being sensitive and mindful to the recent sort of culture shock that comes along with masks and with all of the change going on in our world right now, is there any plan to do any type of sensitivity training or support services for those that are just trying to understand what all of this is and why it impacts their neighbors, their families, for the students, and also for the teachers, of course? But is there any type of discussion on training or more awareness, education on why this is so important to follow along with the rules that the schools are putting in place?
Yeah, go ahead, Dr. Hackman, you go
No,
first.
Dr. Grove, go ahead.
This was a topic of discussion with some of the folks on some of our pandemic teams, and our assistant superintendent, Dr. Giffing, has talked about this a little bit as well. Just making sure that we have some training so people understand, here's why we're doing this. It's easy to say we're doing it because we were told to do it, okay? But that's not good enough. Okay, we need to explain the why. You think with your children sometimes, do it because I'm your mother or I'm your father. That's not good enough for a professional staff, and even for our students and parents. They need to know, the broader context of that. Dr. Hackman, go ahead.
And I think that's a great question. And the area of mental health and social, emotional, and well-being has always been a key priority for us, and an area that we continue to train staff members in to support our students, the 70,000 students across the county. There are two things that I'd like to highlight. Is one, we're in the process of putting together a public service announcement, and that is in partnership with Dr. Mahalik at the Mental Health Developmental Disabilities Office and his team, and then Tammy White at the United Way and her team, and the BCIU and the 18 school districts, about reaching our students that it's okay to feel anxious, but let's talk about how we get you support. Let's talk about what that reentry looks like. Because after 4 months, some students, and it could be whether it's the face mask or it could just be that they've been removed from their friends, we want to make sure that we're reaching the students and families with a message across the county that's showing that it's okay to feel a certain way. There are resources and support available, and here's how you can tap into those resources. So that's been something from a county-wide perspective that we've been looking at. And then the second item, if you would have asked that question to us maybe a month ago, we might have had a different answer. But it's interesting how the culture is changing with some of those things, whether it is social distancing, face masks, whatever that may be, changing the landscape for everybody in the community. Students, adults, staff, you're just getting more acclimated and accustomed to that's how you navigate and I don't even want to call it the new normal, just the landscape that we're in today. So those two variables, in addition to what Dr. Grove has shared, I believe really are helping to address and will help to address as we move into the reentry.
Thank you both for sharing on that. I knew you snuck that question in, but it came to my mind because I think a lot of us as adults are still trying to find ways to talk about our own insecurities or concerns or questions that we have. And so in trying to communicate that to our own families, students, peers, I think there's a lot of room to be had to make for safe spaces to have those conversations. So thank you for the work that you're doing to make the room for that and make it an okay conversation to have. Okay, so how can school districts prepare for an ongoing, potentially blended digital learning approach? And how can business support this? How do we equip, this is kind of a part two, but how do we equip all students with broadband and internet services, being that blended may be in our future for the foreseeable future or forever?
So I think if you were to look at what most school districts are planning to use the bulk of their professional development time for, it's this very topic. If I think back to what districts were spending, were trying to do as quickly as possible back in March and April, was to equip our staff with as many tools as possible, but doing it in a quick, here you go, we got to quickly adapt and move to provide a continuity of education. And some districts were better positioned than others. As was introduced, we do have a virtual learning program that's been highly successful in getting students to stay with us versus going to the for-profit cyber charter schools. And we've actually been able to reduce our budget as a result, and our numbers have grown considerably there. But we've now have to work to scale that to the rest of our district. And so, and I think you'll find that across districts that, to your point, that it's not only the training for virtual or online, but this blended. And so what is occurring in a synchronous environment, but what does asynchronous look like? And how can that asynchronous learning be constructed for students in a way that they can be independent and successful in it. Because I think across the board, feedback that we received from families is, and probably you received from those that may have been working at home, like I give up, like I'm spending a lot of time. And so we've had to adjust. We've had to really look at what is it we're having our students do. So that's our primary focus in our professional development, and dedicating pretty much all the days that we have going forward for that end. Relative to access, and I think this is the other challenge, and it's not, there's a technology component to that. Yes, we were, like many other districts, we bought hotspots. We put, Chromebooks in kids' hands, those that needed it, that sort of thing. But I also look at the access from, do our students have an environment in which they live in that is conducive to this learning? I think that was, we can put the computers in your hand, we can get you hooked up online, but is the environment in which they live, whether the family environment or the home, whatever that is it conducive for them to be focused and able to work successfully through online? And so to the other part of the question of how can businesses support that, that's a tough question in regards to, if the first words that come to my mind is, flexibility for employees. And I think there certainly was a great deal of that, if possible, working from home or adjusting schedules, things of that nature. I think also from going back to the, jumping around a little bit, the equipment, the technology, I know there's education foundations out there that I know are looking to say, how can they support the technology needs that may be needed? So whether that's through EITC programming or just contributing directly to education foundations, I think those are just some of the ways I could see businesses supporting.
And I would just note before Katie jumps into our next question that our third session, a plug for our third session, that will be entirely dedicated to talking through things like the Career Ready Berks platform where businesses can engage. Also discussing any business challenges or business input that we feel maybe as educators we need to be more aware of in being flexible, looking at things where, when things like childcare come up, or when things like supporting through EITC, what do all of those things look like? So our third session will really dig deep on that. Just make sure you sign up for the third session too, everyone. But Katie, you're up.
Thank you, Ellen. Before we get into this question, I do want to toot Ellen's horn, as well as several of our presenters, their school districts, and I know many of our attendees today. This next question is about PPE and the cost of school supplies. So I want to say thank you to a lot of the folks that are participating today that were part of the Berks PPE Resource Network, and giving of your time, your supplies, your 3D printers, and your afternoons to get that material out there. And I know they won't take credit, so I'll shout it out for them. But the question is, will there be a significant need for PPE supplies that schools will need to source? And how will the overwhelming costs associated with these materials be covered?
Katie, thank you, and a great question. And yes, I would also like to thank Ellen and the team who put together that resource group for personal protective equipment. It was needed, especially in a time when I would call it was a pandemic crisis at the time. But there's still a need for PPE as we think about moving forward and where we're going. Berks County, we have been fortunate to have a lot of people donate a lot of materials and supplies and items to support not only the education community, the healthcare community, the business community. So it has been a collective and collaborative effort. I do just want to take you back, though, a little bit on your question, that the second week in March, before the actual mandated closure was, for the facility closure was issued by the governor, we had, and our BCIU leadership team members put together a job-alike session to talk about COVID-19 and how we were navigating that. So all of our administrators across Berks County, educators, we mentioned nurses, operations, facility, technology, professional development, everyone got together for a summit, knowing that we had to be organized and coordinated. So during that summit that we had over 250 participants come on site. And that's before we knew more about the coronavirus at the time. But one of the strands was dealing with operations and facility directors. And they've spent a lot of time planning for PPE and what that needs to look like, not only for what we called a phase 1 reentry, but a full reentry as the school year starts. So as early as the second week of March, they were already putting together that information, the second week of March. So we've had a little bit of runway time for planning and preparation. Now, not knowing that we would have to buy it for such a large scale for a full reentry, we're fortunate that we have received CARES funding. And for those who are on the line that aren't familiar with the CARES Act or CARES funding, that's the Coronavirus Aid, Relief, and Economic Security Act. And the CARES funding you can utilize for purchasing of PPE materials and supplies that are needed. So two things have happened. We've already purchased some of those materials across the county because we were planning back the second week of March. And now as we're doing our reentry planning for a larger scale, we're utilizing CARES funding from the federal level, but then we also have local partners that will continue to support us as we navigate ahead. There are many active parents, business leaders who are willing to donate, and whether that would be supplies, materials, or financial support, we feel that it's an area we'll just continue to work through and be supported in. Now, the only other piece to all of that is, as we know, supply and demand. How much do you need and when will be available? If you try to order something online or through a vendor, they may say, oh, it'll arrive November 1st, and you really need it for August 20th. So those are the things that from a shipping and working through those pieces, but we have many great community partners that have been able to help our operations and facility directors and our central office administrators with PPE and purchasing. So I think we're at least on target for what we need, and the CARES funding and the local support has helped from a financial and supply point.
Look for a couple of local businesses too, and trying to source locally that there are folks that were able to retool and start creating both masks and face shields and some other protective wear. So it's been really nice to see Berks County specifically be able to support Berks County in creating some of those materials. So just kudos to our community and those that have really been innovative throughout this in being able to retool, recreate what their usual products might be.
Well, and that is, if I may interject there, Ellen, it's a great point. We really have, it's an unwritten rule, but a guideline that we look locally first before we go outside, because we think that we want to support one another locally. So when we're looking for supplies, materials, whether it's masks, plexiglass, whatever it may be that's needed, disinfecting materials, hand sanitizer, all of those items, we have what's called a look local first guideline that we look at from a ordering and supply and materials, because we want to support our folks here locally, and then we'll look statewide, then nationally, and then internationally, but it's a local look first.
Excellent. Thank you, Dr. Hackman. Another question. What should the business community be prepared to do to support its employees, many of whom have families with school-age children affected by the adjustments being made at the school structure level? We have a lot of folks that are trying to figure out how to plan. And so what's out there to be able to help them plan, but as well as what the business community should be doing in this process?
And I'll answer that one. I think it really goes back to kind of the underlying kind of foundation of what we're doing. And that goes back to being able to be flexible, being able to pivot, and just provide, that understanding that things can change and things will change. I guess that's what we would ask from our business partners, to be as flexible as possible, to be ready to pivot when your districts pivot. And I know there's challenges, because you may have a parent that lives in one place, works at another, and the district where they live is doing something different than the district where they work. We understand those things, especially when you're going across counties. We have families that do that. we would just ask you to be as flexible as possible and understanding as possible. Dr. Gerhardt and I were talking a little bit as we did the setup work for this. One of the areas of flexibility could be transportation. I know there's some districts looking at, maybe some late starts or some early dismissals here and there, maybe to do some more professional development. And we all know as an educator, whenever we do a late start or an early dismissal, the parents are like, what am I going to do? And just being flexible. I think that's kind of the name of the game. That's what, and we all know that you do that too. You do that in your business models through the economics and through all that's happened. But I think that's probably the best thing that we would ask of you is to continue to be flexible, continue to be ready to pivot as things change on the ground.
Much appreciated, Dr. Grove. We've been hearing, especially on the transportation side, that's a really big area of concern if you're going to be able to handle social distancing. I know there's some school districts that have talked about having no busing whatsoever, and how do parents plan for that, and how do you manage the family with a work day? So it's going to be a really difficult thing for everybody to have to answer.
Dr. Grove, I would tell you though, pivot has become a bad word. So we're going to have to find a new one for you soon.
Well, I was a basketball player, so I do know how to use my pivot foot. So just like.
All right, this is the last and final. So you've made it through here. And we did touch a bit on training with reentry, but I think let's open up for a little bit more of a discussion surrounding the types of reentry training available to staff, students, but I would like to talk specifically about for parents too, because I think with so much change, both in trying to accommodate their kids and students, they're also trying to have conversations with their employers and with, trying to balance work and their students' experience with school. So how are we talking to folks about that? How are we providing that ongoing training, professional development? But I know with parents, that's the hardest group to get to normally. And so during a pandemic, I imagine it's just that much harder. So what are some tools or things that you might be doing to connect with the parents and guardians of these students as we look to go back to school?
Was that a question to us, or are you throwing out to everybody? Us? Okay. So right now, that's an open question. And so your feedback as far as what they're looking for and what's needed, I think just to, we've sent out resources in the past to help parents in regards to how to talk to your child about, well, I'll use the sort of the events in June, talk to your child about race. And so this is an area where we also will have to work to develop some resources to put out to our parents. I think the conversation earlier was how to help kids, as adults, we're still processing this, but then how do not only our teachers talk to kids, but how do parents talk to students? Right now, I will tell you that our number one focus, right or wrong, just is with our staff and doing some training with that'll then apply to students, because thinking about the school day itself and the reentry. So we use a number of different platforms, everything from whether we have staff in smaller groups in this case or students in the classroom, but we also use a Safe Schools portal in which we put training videos out, which I'm sure a lot of employers do. And so we're putting one together now that will reside for our staff to access, of everything from as simple as, flexibility and good judgment needed during this time, working together, to our custodial staff, cleaning areas, SDS documents, and then things around hand washing, social distancing, how to wear a face mask, how to wear a face shield, reporting travel. That has been something in the last 2 weeks that we have started to create our reporting system with our staff over these summer months for their travel. Right now, we know that the quarantine is a recommendation, but should it go to a mandate, or should there be other areas that we need to use judgment for? And then also the daily health assessment that we are asking our staff to do, as well as right now, we do have voluntary workouts happening with our fall sports. So our students have been back on campus for the last few weeks. We've had, if I were to number it, we're, a couple hundred students that have for the last 2 weeks successfully been back on campus. But we've had to do training with those student athletes about social distancing. They need to arrive with a mask on. When they arrive, they have to go through the 4 questions each day to account for that health assessment. Our coaches have to go through that protocol each day. And so this has given us a short amount of time to do some of those initial trainings. But to your point, the one on parents is one certainly that needs some more development.
I think also to add to that, and Dr. Gerhardt covered it well, through the IU and our professional development office, we are putting together what we're calling county-wide materials that then each district can customize for dissemination. So that'll be something that we'll be working collaboratively with our job-alike leaders across the county to develop those tools, and whether that's using our school psychologists, our school nurses, our school counselors, but we'll coordinate that from a county-wide perspective. Just when we first had this situation with COVID-19 announced, we put together county-wide materials for hand washing and how do you educate your child at home, or how do you go through a checklist. So those tools are under, and supports and resources are under development and will be available, I would say, within the next 3 to 4 weeks. But much of this is going to be hinged on our reentry plans and what that'll look like. And our target here is by the first week of August or so is that we have clearer direction, but we just know things continue to change. And we actually think pivot is probably an okay word, because it's better than saying, oh, we changed our mind or we've changed our decision. We're just going to pivot based on what we know on new information. So I say that lightheartedly, but it is something that I commend our educators across across Berks County, that in regards to, they've been working with us to pivot day to day. Our administrators have been working with us and supporting us, and our students and families have been very understanding. But we recognize as we get closer to August and as we get closer to the start of the year, people are wanting more direction and more information. So another avenue that I know most of the superintendents have been utilizing would be either video messaging out to the community so that they can give information. They've been sending newsletters out. They've been posting things on social media with updates when we have new information. So again, all of that is in process as we speak.
Just a follow-up question there. Have you found that there's one venue that's better than the other? Is it social media? Is it newsletters? Is it video chat, or even the calls that sometimes we'll get? The not automated calls, but the messages, because of dealing with different audiences and different age levels as well, as far as comfort in receiving information. Is there a certain tool that seems to be working best for anyone?
I think it's a mix, and I think it depends on the message. So I know we've used a variety. Sometimes it's written because maybe there needs to be clear, pointed information shared. Other times maybe, it's a message worthy of a video. And so I think we've tried to mix it up so that it's just not drowned into the same. And we've used, we have our direct parent notification that I know most districts have, as well as, depending on the message, we've also put it on social media. We don't do every message on social media because we know that sometimes our communications are more pointed to our parents, where our social media is more of a larger community, beyond community forum.
And I'll echo that. There are internal discussions about, okay, what about this message? And sometimes it's a no-brainer. It's going on everything. Other times it's just to our parents. Sometimes it's just a voice message. Sometimes, I think, like Dr. Gerhardt said, we might do a voice message and an email so people get to see it and hear it. Again, it just depends on the content and the context.
And just to wrap up the answer or response to that question, Ellen, which is just fantastic. It was part of our Safe 6 document. The communication column on there was one of our Safe 6, because we know communication, messaging, information is powerful. So the more information we can give to not only our parents and students and staff members, but the community, it helps everyone all around. So that whole idea of communication has been very strategic and targeted and methodical as we've navigated through the past 4 months and as we move into the reopening of school.
I can't help myself but ask one last question to that. Is there a comprehensive way of providing some of this information in other languages, primarily in Spanish, or is that a tool or something you would be looking for support for from our business community, those that provide translation services? How does that look, or how is that being approached as we move forward?
I'll take that. First of all, we have a system, it's called a Skylert. It's the one that it's our phone messaging system. And some of the tools on there will do that for us automatically. So some of the messages that we create, that we put on to that system, it's immediately changed into Spanish, and the end user often can choose what that looks like. They can choose to receive that in another language. So some of the tools have become much more intuitive. Not everything is that way, but I would say some of our more important messages we put on that platform, knowing that our parents that want to receive it that way, the system does it for us.
One other key point is that we've been again, there are so many languages that we could be translating information into, but we've been sensitive to translating everything from English to Spanish. And while we have internal supports, we also have tools, whether it's Skyward, Blackboard Connect for messaging, that will make that conversion. But we've also had support from Mike Toledo at the Hispanic Center. So that's been another great resource when you think about community partnerships, about getting messages out to families. So again, that language, we don't want that to be a barrier to the communication. So that's something we do pay great attention to.
Thank you so much. I will not have a follow-up question to the follow-up question to the follow-up question here. So in fact, in being mindful of time, it's 2:09. So we have gotten through our questions that we had planned for today. Thank you so much to Dr. Gerhardt, Dr. Grove, Dr. Hackman, the IU, and all of our school districts for being so mindful and taking the time to not only talk with us today, but to continue to survey all of our districts, survey the families that are being impacted by this, and being really mindful of taking in the feedback and ultimately weighing the impact of some of the decisions that are being made as we do continue to pivot, which is a necessary word, and move forward. And again, this whole thing is so new for all of us. So I think in its simplest way, us all being kind and just taking the time to listen to one another and hear how plans are being made to better understand them is why we felt it was so important that we have this forum, to provide that forum for education and awareness so that we can move forward together. I want to acknowledge that I saw a lot of discussion and some comments and questions in the chat. We are not going to be able to explore those questions and comments today, but they are being seen and they will be saved. So we will take a look as a group and get back to all of you with whether it be a follow-up email or a quick Word doc with some answers to some of your questions. We do see them and we do acknowledge all of your comments, and thank you for providing your feedback. At this time, I would offer, if anybody has any closing remarks, any of our speakers, now would be the time to share some closing remarks.
I'll let Dr. Gerhardt and Dr. Grove go first. So Dr. Grove.
Sure. I just want to thank everybody for being here this afternoon. We know how important your work is because you support all of the families in Berks County. You employ many of our parents, many of the students that we have also work out in our communities, and we know how important that work to home connection is, and schools kind of finish that triangle. So just thank you for the work that you do, and I thank you for just being here today to listen to us and learn a little bit more about our challenges, but we also want to hear from you as well as we move forward what the challenges are that you have. So thank you so much for being here.
Dr. Gerhardt.
Just to, echo Dr. Grove's comments. So thank you.
Great. And I'll just share, and before I turn it back over to you, Ellen, for the final closing comments, I do want to say again, thank you to each and every one of you. I know that we are in some, again, unprecedented times, but while there may be challenges and changes and we are pivoting, please know that the educational leaders in Berks County are committed to serving, supporting, planning for those 70,000 students that we serve, working with our families, our community members, business leaders to make this reentry a success. The health and safety continues to be our top priority as we balance with offering a high rigor, robust instructional program as we look into the 2020-21 school year. But again, we see this, I feel fortunate to be in Berks County because of the level of commitment, dedication, professionalism that is offered across this education community is like no other place. So again, thank you for your time. If you need anything, please don't hesitate to reach out to myself at the IU, Dr. Grove, Dr. Gerhardt, or any of our IU staff members. We're here to serve and support however needed. So again, Ellen, thank you to you and the GRCA for organizing this.
Very, very welcome. Thank you again for being so open and in a time where things are still just a bit unknown and we're not sure and plans aren't finalized. So coming into a conversation like this can be, tricky and trying to figure things out and making sure that we're giving the best information while we also navigate the unknown. So thank you so much. And what I would do now is just plug these last two sessions. So we have our next session on July 22nd. That will be next Wednesday, same time, 1 o'clock. You can register at greaterreading.org. And that will cover impacts on childcare. And so our speakers will be Karen Grimm-Thomas, External Affairs with the Office of Child Development and Early Learning, as well as Christy Weitzel, Assistant Director of Early Childhood Education at the BCIU. So we will have those speakers lined up for you for next week, and we will cover the gamut on how not only childcare facilities and providers, but also the impacts of childcare for those of our employees of our local businesses, how that will translate going into the new year, and even just the impacts so far and to date. So we will really dig into that conversation next Wednesday. And then our final and third session of the series will be a business feedback forum that is July 29th, again at 1 p.m. And we will be joined by Stacy Dunleavy and Jillian Darlington with the IU, as well as myself. And we will talk through and facilitate through business questions that we will have gathered from each of you prior to the call so that we can be mindful in responding directly to those questions. We will definitely cover Career Ready Berks, which is a platform facilitated by all of our school districts, but really led, BCIU really leads the charge on, again, having all of our districts collaborate around that platform, which provides our businesses an opportunity to promote job internships and outside work experiences, and even just mock interviews or speaking engagements or career exploration. So how that platform will be leveraged and maybe altered to be accommodating of a more virtual experience for our students moving forward. We will also talk through, again, those challenges and those questions that our businesses still have, because as we know, in 2 weeks, we may be looking at a very different plan across the county and across the state. So trying to be timely in answering those questions as we're all looking to the next steps. So I would strongly encourage everybody to join that conversation. Again, if at this time you have any questions, comments, please throw them in the chat now. We will keep that open for another minute or so to make sure that we're accommodating your questions and comments. But again, we really appreciate you being here today and look forward to keeping the conversation going with everyone. Thank you.